Good morning. It's 9:30. Today is Saturday, March 13, 2021. This is our regular scheduled yoga therapy class through Saptic Space, which we have been doing it for years and years, and now online due to pandemic. Today's discussion and practice will be a beautiful title, Yoga Therapy, Journey into Silence. Let me explain to you a little bit before what a journey into silence means. That as all of you know, the yoga is a philosophy. It's a philosophy, it's called Yoga Sutra. There are 196 small aphorisms, of which 193 to quiet down your mind. Practice called 8 limbs. Yam is a social restraint, Niyam is a personal restraint, Asana is a external and internal alignment, Pranayama is voluntary regulated breathing, Pratyahara, control of 5 senses, Dharan, focus, Dhyan, meditation, Samadhi, union of your body, mind and spirit. Practice of yoga was started as an outcome for self-realization. And during the practice of self-realization, we find out there are some health benefits. And those health benefits, we can use it as an adjunct therapy to our Western medical practice. The use of the philosophy and the practice and its adaptation based on a patient's clinical condition is the yoga as a therapy. With all of our experience, research, and observation, we find out that the real therapeutic benefit of yoga is the meditation. That's what we call meditation is the medication. In the meditation, your mind unites with your individual soul. Our soul resides in your heart. So mind unites with the heart. Heart-centered meditation. When you go to the 8th limb, that's a samadhi, which is also called union of your individual soul to the universal soul. So mind needs to be in a effortless ease. Remember the word dis-ease, D-I-S space E-A-S-E. So therapy for dis-ease is your effortless ease. And effortless ease comes in a state of meditation. Mind in yoga is described as the content of your 5 senses. I hear, I see, I smell, I taste, and I touch. Control of your 5 senses, which is the 5th limb called Pratyahara. Pratya means rejection, Ahara means your intake. We have intake through our 5 senses, and we learn how to control the intake of our 5 senses. So what happens when you start doing the physical postures or the asanas, slowly you enter into a state of relaxation response. In a state of relaxation response, you have an activation of the para parasympathetic tone, which is your calm and digest. And in that state, your breathing becomes effortless, breathing rate comes down, breathing almost becomes silent. You don't even hear when you are breathing. And the five senses starts to quiet down. So what happens when the five senses starts to be under control? You slowly enter into the silence. Excuse me. And the silence is the state of meditation. That means we are in a state of meditation throughout the whole day, 24/7. Also remember, I always say, your practice prepares your body, breath, and mind to be in a state of effortless ease for next 23 hours. So now, let's go ahead and start practicing. The first practice we'll do is that able to control our five senses, and we'll go a sense by sense, and I will show you the practices, and we'll see by the time you'll be able to learn how to control your five senses, that you will be entering into a silence. The first, as a asana practice, and I hear a lot of time all the yoga teacher ask me what happened to our first limb and second limb, social restraint and personal restraint. What I tell all the time to the people, you keep on practicing your third, fourth, fifth limb, and you will see slowly and slowly all of your first limb and second limb will come to you. Like non-violence, telling truth. Brahmachari, having a very regular, regulated, controlled life. Non-stealing, non-attachment. This thing will all come to you when you keep on practicing yoga. The first, when you start doing asana practice, as I said, you need to create a relaxation response. And we do it all the time. We have a standard practice, we do it. Let's do it again. Like as I said, I'm sitting down. This is your called easy pose, Sukhasana. You take both the feet, cross it in the middle, keep your spine straight, and you will be able to do it in your chair also. If you can sit down in a chair, you'll be able to do it in a chair. What is the minimum requirement for the relaxation response to set in? Is your spine straight, called Merudanda Achal, and quieting down your mind. Manasthi. I have people who come to my class and says, I cannot even close my eyes. The moment I close my eyes, I become very fearful. So I said, you don't have to close your eyes. Pretend you are closing your eyes, then you follow your breath. Breath is a connector between your body and mind. Mind is a software, body is a hardware. So in this posture, after a while, remember you have to looking for two signs. No pain. If you get a pain, you back off. Find a spot where you have a little discomfort, comfortable discomfort. And if you're practicing with me, you can do it. Sit down, find your sweet spot and stay in the spot. When you stay in the spot, the muscle initially contracts to let you get into this posture. Muscle ligaments cannot stay contracted too long. They'll start to relax. It's the beginning of an asana practice, and slowly it gets into the phenomena where the twitching goes away. It's called stability. And the stability, then you get a profound relaxation. The relaxation takes place, you will see, feet will drop down like this. It's a wonderful experience. Next you change your feet. Balance. Health is defined as a balance of your body, mind, and spirit. This activates both sides of your brain. Always practice in balancing your asana poses. Next, your hand, touch your index finger and thumb. This is called a mudra. Hand connects your body and mind. So have the Dhyana Mudra, Jnana Mudra, put it in. Close your eyes. Even if you cannot close your eyes, just look straight to a fixed object. That is almost equivalent to closing your eyes. Remember, eye is the direct extension of your brain. Eye has a very big nerve in the back called optic nerve which goes straight into the brain. So we just say, eye is the brain which is not covered by your skull. If you can close your eyes, close your eyes. Pay attention to your breath. Lung is like a balloon. It has 6-liter capacity. It needs 1.5 liter to keep it open. 4.5 liters can be exchanged, which is called vital capacity. We only breathe 0.5 cc. Learn how to breathe out. Practice with me if you are practicing with me. Breathe out first. Take a deep breath in. Breathe out longer than breathing in. If you're used to counting, just do the counting. Do it count of 2 in, count of 4 out. If you're comfortable in that, you can progress to count of 3 in, count of 6 out. Count of 4 in, count of 8 out. We have been doing for a long time. We can do easily count of 8 second in, 16 second out, 10 second in, 20 second out. Let's practice a few times and you stay where you are comfortable with the effortless ease. Remember, every asana practice, you have to have your no pain and your breathing is completely effortless. Very, very important concept. Breathe out first, count of 2 in, count of 4 out. Let me progress to show you how to do it. You stay where you are. Do next 3, 4, 5 sets of breathing to quiet down your mind. Breathe out first, count of 4 in, count of 8 out. Very easy for me. I can do easily count of 8 in, count of 16 out. It's a wonderful practice. Progress a little bit. Take your heel to the back. Put your one foot in the top. Your knee drops down. This is your Siddhasana. Perfect pose. Now incorporate a breathing technique. It's called your bumblebee breathing. Brahmali Pranayama. In a Brahmali Pranayama, you shut down your five senses and will also practice how to quiet down your five senses, how to improve your five senses. And then you create a vibration. The vibration is the same frequency as the frequency of your brain. Two frequency cancels. It's called harmonic resonance. Quiets down your mind to the point that you enter into a state of silence. Remember, you don't practice to be in silence. You practice the component which will lead you to the state of silence, which is a state of meditation. I teach a class on how to prepare your body, breath to enter into a state of meditation. So I've done all with me. Put your index finger in the forehead. Use your three fingers to close your eyes. Use your thumb to close your ear and close your mouth. Always breathe in and out through your nostril. Breathe out first. Take a deep breath through the nostril and breathe out with the sound of a bumblebee. Follow that with the humming and cupping. Keep rubbing your hands, keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, remove your glasses, take the hands like a cup, put it over your eyes, let the eyes take all the heat from your hand, which causes relaxation of the ciliary muscles. When the ciliary muscles are relaxed, your lens became more convex and your vision improves. Massage your forehead. All the muscles under the skin are attached to the skin, which gives all the frowning, gives all the line. Massage your face, massage your nose, massage your ear, behind your ear, front of your ear, inside the ear canal, in the earlobe. This is called the auricular branch of vagus nerve. It activates your vagus nerve. Bring your hand down, massage in the front of your neck. This is called carotid sinuses. Carotid sinus activation also causes activation of parasympathetic tone with a quieting down of cardiovascular system and nervous system. Massage the back of your neck. So progressing next is your, remember, relaxation response comes to you. This is your half lotus, Ardha Padmasana, Swastika Asana. So now you learn how to control your five senses to enter into a state of silence. First, you start with the eyes. Yoga gave us that cleansing of your physical body, which is called kriyas. There are 6 kriyas. First one is called tratak. Tratak is for your eyes, improving function of your eyes, quieting down your eyes, and able to have a control over your eyes. Nasya, cleansing your nostril, which also gives a control over your other sense, smell. When the other smell gets better, your taste gets better. Taste and smell is connected, and we'll show you step by step how to control your 5 senses. Dhoti, washing your stomach. You wash your body, wash your face. Why not? Why not your stomach? A lot of dhotis, called Vaman dhoti, drink water and wash your stomach out. It's called a kunjal kriya. It's like an elephant. Vastra dhoti, you swallow a thread, you swallow a cloth and pull it out. Danda dhoti, drink enough water, then put a red rubber tube in the stomach and it gets cleaned up. Kapalbhati, when it's done very rapidly, it's a kriya. Done slowly, it's a pranayama. Nauli, isolating your rectus muscle and massaging all the intra-abdominal contents, and your basti, cleansing your colon. In a tratak, what you do, your blinking is both voluntary and involuntary. So starting from the morning, so in a yogic daily routine, you first, when you get up, you sit down in your squatting pose, drink a glass of water, which is called a ushapan. Then you have a regular good bowel movement. During your morning ritual, when I do the brushing my teeth, tongue scraping, I wash my nostril with a neti part called jal neti, also wash my eyes. Washing your eyes is the first step to start quieting down your vision. In yogic tradition, you take the water, you splash the water in your eyes and you clean it. There is another tradition in Ayurveda which is very gross in our Western practice, what I'm going to just mention to you. You may like or may not like, but there are some scientific reason behind it. You take a water in your mouth, you gargle a little bit, take the water out in your mouth and put it in your eyes. Mouth has a highest or a large amount of immunoglobulin, and it's a healing, there's a lot of healing potential from your mouth. How do you know? Look at the animal world. In the animal world, they have an open wound. To keep the wound, they will lick the wound for proper healing. So wash your eyes. In a tratak, you do what is called a jyoti tratak. Jyoti tratak means you sit down comfortably. You can sit in a ground, sit in a chair. At your eye level, you put a flame. And then flame, you keep straight looking at the flame without blinking. What does blinking does? Remember, blinking is both voluntary and involuntary. I can blink my eyes on my own, and if I don't, I will blink involuntarily to move the fluid out of my eyes. So able to control your blinking is the controlling over your autonomic function. Voluntary control over involuntary function. You can also do that with your finger. Like here, you can put an index finger in front of you. Keep looking at the tip of the index finger, and then without blinking, slowly bring that finger close to you. If you're practicing with me, you can practice and see. Do not blink. Keep looking at the tip of your finger and bring it close to you. You will be able to look at even it comes and touching the tip of your nostril. Can you stay here? Stay here as long as you can without blinking. You might start having some water coming out from your eyes. This is the first practice of Tratak. Improving the eye health and also able to control your eye function. Then remember eye muscles. We have a lot of muscles inside the eyes which are supplied by cranial nerve. We have 12 cranial nerves. This nerve comes from your brain and the brainstem, and we have spinal nerve roots which comes out from our spinal cord. Cranial nerves are very important. Able to control the cranial nerves will be able to quiet down your brain and essentially your mind. We used to remember what's called SO4-LR6. SO4 stands for a muscle in the eye called superior oblique. Superior oblique is supplied by 4th cranial nerve, and LR6 is a lateral rectus, another muscle supplied by the 6th cranial nerve. And behind the eye, the retina, it connects with your brain through a 2nd cranial nerve called optic nerve. So there are movements of the eyes which will stimulate, and essentially you have a control over your cranial nerves. The first, you put your hands on both sides, you keep your thumbs, and without moving your head, you'll be exercising your eyes. It's called Tratak. Look at the left thumb, look at the right thumb. Look at the left thumb, look at the right thumb. Many a time I do closing my eyes and do with my breathing. I breathe in, looking to the left, breathe out, looking to the right. Little difficult when you have your eyes closed, but essentially you'll be able to do it. Shift your hand one high up and down. Look right up, look left down. Look right up, look left down. Shift your hand up again. Look left up, look right down. Look left up, right down. Look straight, high up, look down. Look high up, look down. Then you put your hands together, preferably in a Hakini Mudra. And then move your eyes in all different directions, both eyes. Look up, left, bottom, right. Up, left, bottom, right. Up, left, bottom, right. The up, right, bottom, left. Up, right, bottom, left. Up, right, bottom, left. Finally, you completely do the circulation in a continuous way, as rapid as possible. It's a wonderful practice for your eyes. Next, what we do to control your blinking, that you tightly close your eyes with the relaxation. The relaxation to the Adhi Mudra. Put your hand, close your eyes with a breathe in. And with the breathe out, open your eyes. This all in relaxation. When you relax, your vision gets better. Your eye health gets better. We know from our experience, like we know during anesthesia. During anesthesia, I have noticed many a time in the operating room, when the anesthesiologist gives a muscle relaxant. They give a muscle relaxant to a patient before they do the intubation. And the muscle is relaxed. I heard many patients says, oh, I can see the crack in the ceiling. They see a lot better. So the next eyes relaxation, which we have done already, but let's do it again. Palming and cupping. Take both the hands again. Keep rubbing. Keep rubbing your hands. Palming and cupping. So when you do palming and cupping, when you feel the heat in your hand, you wearing glasses, you remove your glasses, take the hand as a cup, put it over your eyes, let the eyes take all the heat from your hand, and slowly massage your forehead, massage your eyes, massage your face, massage behind your ear, in front of your ear, inside the ear canal. This is activating the auricular branch of the vagus nerve. Your hand, massage the front of your neck, activating the carotid sinuses, activating the vagus nerve. Eye health also gets better when you practice your gel neti, a neti pot. In a neti pot, what we do, we have this pot, we put a lukewarm water, and you put a little non-iodized salt, put it through one nostril, keep our mouth open, breathe through the mouth and slowly tilt head on one side. When all the inside is completely relaxed, water will come out through the other nostril. Simply when you finish, blow your nostril, like all the mucus gets relieved. Use the same neti pot again, do from the opposite nostril. I have done it so many times. And after that, you do little Kapalbhati Pranayama. Different postures. Standing up, bend your head down. Head on one side. Other side. Finally, your frontal sinus. initially have a lot of irritation in your nostril, and the irritation shows up in your eyes. Your eyes will start burning. You will have a lot of watering from your eyes because your lacrimal gland gets stimulated. Slowly and slowly with the practice, the irritation will go away and you'll see your eyes will come down. So Tratak, pumming and cupping, Jalneti, and finally, since the eyes are supplied by the cranial nerves, we have another two muscles in the neck. One muscle is called a sternomastoid muscle, which you see one on this side, and another is the trapezius, one on the side of your shoulder. The sternocleidomastoid muscle and the trapezius muscle, both are also supplied by your cranial nerve, accessory nerve. So able to do your relaxation of the neck muscles and the shoulder muscles will also helps your controlling and improving the vision of your eye. Which you do it all the time. Let's do one more practice, which we do for the upper part of the body and the shoulder complete relaxed. We do the prayer pose to the back. Take the hands as a prayer pose. Slowly and slowly you will see the hands is going to go high up. Then you will do the 4 movements of the neck with the sound of a bumblebee. Breathe out first. Take a deep breath in. Slowly drop your head to the back. And you'll bring your head in the front to the sound of a bumblebee. Just be sure you don't have any pain and have effortless breathing. Do it with your eyes closed. When you do the eyes closed, you'll feel a profound level of relaxation. When the relaxation sets in, all the 5 senses gets controlled. Side to side movement. Breathe out first. Deep breath in. So how long is the exhalation? Exhalation gets longer. Exhalation is parasympathetic, inhalation is sympathetic. So longer exhalation brings a proper relaxation and calming and quieting of your 5 senses. Opposite side, breathe out first. A deep breath in. Look it to the back without turning your shoulder. Turn your head left to the back to the right, then right to the back to the left. Drop your head down, breathe out first, take a deep breath in. After all relaxation practice, always practice pumping and cupping. It's a wonderful practice. You keep on doing it every day. I teach the kids, children who are wearing glasses, because the relaxation of the eyes improves your vision, quiets down your eyes. Let the eyes take all the heat from your hand, massage your forehead, massage your eyes, massage your face, massage the back of your ear, front of your ear, external ear canal, bring it, massage the front of your neck to stimulate carotid sinus, massage in the back. Vision. When you're able to control your vision, when you're able to improve your vision and eyesight, when you're able to learn how to able to close your eyes and then stay in a state of closing your eyes, this will bring your effortless ease, and it is the treatment for your all the chronic endogenous diseases. Hearing gets better when you will keep your eustachian tube open. There's a tube which connects between your middle ear and your throat. Remember, when you have a pressure change, when you're in a plane or when you're in a high altitude coming down, it's your ears, feels like ears are blocked. Then what do? You try to swallow. When you swallow, it opens up. Yogic tradition is called Korno Rogantor Pranayama. Korno means ear, Rogantor means removal of the disease, that means you are curing the disease. Pranayama is your voluntary regulated breathing. This is also in Western medicine called Valsalva maneuver. Another thing we have noticed in our observation is that out of our 5 senses, when one sense is not properly working, your other sense gets better. For example, if you don't have any vision, if you are a visually impaired, you'll see your touch gets better. Visually impaired person, everything they find with the touch. I have patients visually impaired, they have a touch is so good, they can even feel my cloth and they say, you are wearing a dark color outfit today. They'll feel a cloth, they say, you are wearing a light color outfit today. I've seen this. It's amazing what it does. So improving your hearing also will take place when you do your function with closing your eyes. So let's practice Korno Rogantor Pranayama Valsalva maneuver. Basically, you will be breathing out first. Take a deep breath in. You'll be closing your nostril, closing your mouth, and trying to blow out against resistance. And also in a hand, you do Adhi Mudra. I always try to do the Adhi Mudra. It is a very nice, relaxing mudra. So breathe out first. Take a deep breath in. Close your nostril and mouth. Can hear the eustachian tubes are open and is hitting on my tympanic membrane. One more time, Korno Rogantor Pranayama. It is to improve your hearing and to keep your hearing function. Breathe out first. Take a deep breath in. Close your nose and mouth and try to blow out. Another thing happens for your ear is it develops build up some waxes inside. You started probably losing your hearing. In yogic tradition, we put a drop of oil. Drop of oil in each ear. One drop of oil in the left ear, one drop of oil in the right ear. And in some traditional South Asian practices, especially in Thailand, they will do what is called the ear picking. They will wet the ear with a little bit of oily mid substance. For oil, people ask me what oil. People, the Vata type uses sesame oil. People with Pitta uses the coconut oil. And people with Kapha use the mustard oil. They'll put there, then they'll never put a cotton swab inside your ear if it is dry. Many a time if it is wet, if it is oily, even after shower, or if you have the oil inside, you'll be able to put a little cotton swab and you can stimulate a little bit. What they do, they stimulate the external ear canal, which brings a profound relaxation response. It's called activation of the auricular branch of the vagus nerve. It is so relaxing. It is a part of called traditional Thai massage. You can have some tinnitus, ringing in the ear. In a ringing of the ear, what happens? You have a frequency. You hear a ringing. And many a time, we as a physician find out sometimes we have a slow blockage in an artery called carotid artery. The main vessel which takes the blood inside our brain, when it starts to get a little narrow, the blood flows through there and it makes a turbulence. which is called a bruit. I can put a stethoscope and I can hear a bruit. This is a very common clinical finding for the physicians and the medical students. That sound almost sounds like a sound of a tinnitus. Many a time that sound gets transmitted into ear, you can hear a tinnitus. So as a physician, when you have the tinnitus, be sure you pay attention to your carotid arteries. Be sure that it is not a transmitted bruit. When tinnitus again, what happens? The frequency cancels, harmonic resonance. And you practice again Brahmali Pranayama, bumblebee breathing. In a bumblebee, you're generating the frequency. In a bumblebee, you can do the closing also senses called a Shanmukhi Mudra. You put your index finger in the forehead, then use your two fingers and slowly bring it down. You can close your mouth, you see, with the two fingers. Then you put both, ring finger here and see that I'm putting the finger so that I can close. Closing my eyes, closing my nose, my smell, closing my mouth. So this is a mudra which also controls your five senses. Then it creates the bumblebee sound. At the thumb, you close your ear. For the smell, olfactory bulb in the nose, the smell, what you do, you use the jalneti every day, every morning, which we do it. We do jalneti every morning. We brush our teeth, scrape our tongue, do jalneti. We're doing a yoga therapy retreat on Sunday, week from tomorrow, the March 21st, and that will be the role of yoga therapy for COVID-19, and I will demonstrate the jalneti in your virtual platform. So when you do the jalneti, remember when you blow everything, and you'll be surprised to see how much dirt you have inside your nostril. All the mucus, because nose is your personal filter. And people all talks about me, what happens if wherever the water is going is that, nose is a very resistant. You can go and dip into the public pool. So jalneti is very important. Another very important is your oleation of the nostril at night. So what we do before going to bed, we do it, and I have shown it to you many times, and you can go and on my YouTube channel, you can go to the YouTube called Daily Routine. We dip into our little finger in a little oil or in a ghee, you can use a ghee, and put the little finger inside the nose and massage the nose and put an oil all over, both sides, and then you go to bed. And what happens in the oil, that nothing sticks. The mucus doesn't get dried up. So there was no dry mucus inside the nostril. It is very oleated, oily there. The smell gets better. Smell is connected to your taste. Taste in the tongue, we have 6 tastes. All the 6 tastes, we have 4 tastes in West and 6 tastes in East. 4 tastes in West, bitter, salty, sour, sweet. Japan, there's another taste called umami. Umami is the 5th taste in the Japan. And in Ayurveda and Yoga, there are 2 more tastes. One is called astringent. Astringent is contraction of your oral mucosa. Like if you put some tannin, put a strawberry, or you put another called amlaki. Amlaki is an Indian gooseberry. When you put an amlaki, you will see clearly it's an astringent taste. Astringent has a very powerful healing property. It heals by contracting the wounds. And 6th sense is a pungent. Pungent is because they're hot, heat, chilly. When you put a chili in the mouth, you know, because when you put the pungent, you'll perspire. You'll perspire here, perspire in your head, perspire in the whole body. It has a profound physiological effect, which also being used as a healing. So remember, I said you change your feet slowly, one at a time. And if you notice it, the way I do it, I take little time and I do it slowly and easily. I don't get in and out very quickly. I can. But I'm showing it to you, that's the best way to do it. So, enough for the taste. In the morning, after brushing our teeth, we do one thing we call Oliated Gum Massage. You take a little bit of oily finger, dip your finger in oil, then massage the gum. Massage the gum. It helps the healing in the biting, in the chewing. It helps in your taste sensation. Then the tongue has all the coating. In yogic and Ayurvedic tradition, tongue is the window of your gastrointestinal system. We have a tongue scraper, we take all the way to the back and slowly scrape out all the coatings of the tongue. When the coatings of the tongue are removed, your tongue is clean, exposed, and you put a food in the mouth, you'll be able to feel the taste of it. Very, very important for the taste of it. So, in our tradition, just remember we are entering into the state of silence. Most important silence taking is your controlling your vata. Vata is a mobility of your mind, mobility of your physical body. So when you look at the scraping of the tongue, when the color of it little whitish, you have a kapha predominance of the day. Color is little yellowish, you have a pitta dominance on the day. And you have a little brownish or blackish, you have a vata predominance. So you practice relaxation response and activation of the parasympathetic tone for the taste of it. Also remember, taste and smell is connected. So if your nose is stuffed, nose is blocked, you don't taste anything. Same way, if your tongue is coated, you don't smell anything. So we are guiding you slowly and slowly, all the five senses, taming of the senses. Ayurveda says, inappropriate use of your five senses is the root cause of all the diseases. Progga aparad. Inappropriate use of your senses. Finally, for your touch. Very important in the touch is, what we have found out from experiential is that you need to activate both sides of your brain. I'm right-handed, right-footed. I'm always using my left side of the brain. I'm not using right side of my brain. So what happens? If I want to touch something, or if I want to see where it's, always my dominant hand goes there. Because it has a fine motor function. So always learn how to use your non-dominant hand to improve your touch. For us, what we have learned, we first started doing brushing with our left hand. And when we started brushing with the left hand, the brush is all over. It doesn't even close to my mouth. Then it started closing to my mouth. What happened? My right hand was moving like this. This is called neuroplasticity. So use your non-dominant foot. I've shown you many a times. We do the balancing poses. We stand on one foot. We stand the non-dominant foot a little longer and longer until you get a balanced time of both the feet. Then you do with your eyes closed. Modified mountain pose. When you become ambidextrous, you feel better. Then you will see ambidextrous, you will touch with your left hand even if you're right-handed dominant. Next in yogic tradition, it says that if you put a self-massage in your body, it's called abhyangam. Self-massage, called oil massage. We do it all the time. We do it, it's called a snehana. Snehana is a oleation of your body. Abhyangam, massaging, self-massaging your body. Then we do follow that with a called a steam box called a swadhana. Swadhana is your perspiration to open up your hair root after putting oil in your body. When you take an oil in your body, take a little oil in your hand, and all the time people ask what oil. It's all based on your body type. But what I've noticed in India, very regional. South India, they use a coconut oil for everything. In East, they use a mustard oil. But the oil, first, if you start in your scalp, in the center, you massage from center to the periphery. You start in the center, you center to the periphery. Same way, in the face also, from center to periphery. Go to center and then to the periphery. Self-massage. In the body, also the trunk is center to the periphery. The central to the periphery. And also in Ayurvedic tradition and yogic tradition, the yogic put a little oil in the belly button. And there's a lot of reason for it. We'll explain another day. This is a long subject. So from central to the periphery, you massage. Massage very gently, and it really improves your touch sensation. Then on your periphery in the arm and the leg, you do from distal to proximal. Like you start from at the end and keep bringing up the massaging at the proximal, distal to the proximal. Abhyangam, self-massage, from the distal to the proximal. And remember, whenever we are doing this thing, at least for me to collecting that data, I always wear this health monitor, health tracker, and get all the information, what is going on physiologically in my body and mind. By the time you enter into the pratyahara, controlling of your five senses, you slowly enter into dharan called focus. And the focus starts with your visual imagery, and that visual imagery is in silence. Let's practice what is in the silence, and you will see eventually we will practice silence, which is called the heart-centered silence. Journey into silence means journey into meditation. Meditation is a state when your mind unites with your soul. Let's practice. Let's able to sit down comfortably, and a powerful relaxing asana, which I do it. This is your Lotus Pose, Padmasana. You can do it, or you can sit in a chair, or just be comfortable. If this thing is not too comfortable for you, okay, you can sit down in a Vajrasana, Thunderbolt, or you can just simply sit down in a, say, Sukhasana. So let's sit down in Sukhasana. Because you are practicing, let's practice with me. It's a very important practice. If you can sit down in a Sukhasana, if not, even you can sit in a chair. Learn how you're able to close your eyes, because this is the thing I hear and I see many a time. And learn how to use your hand in a mudras. This is a Dhanu Mudra or a Gyanu Mudra, and touch it over your knees. Able to access your subtle body. This is the gross body. Able to access your subtle body. How to access subtle body? Subtle body is the body of your mind. Subtle body is the body of your memory. I've been looking in my body all my life. My mind has a imprinted memory of my body. I don't need to see my body. It's the same, somebody sitting in front of me. I can see the person. And when I see the person with controlling other senses, when I use only one sense, my brain gets an imprinted memory. Next time I think about the person is not in front of me, same area of the brain will get active. And as mentioned so many times, like my eyes are closed, I'm clearly seeing my body. I can touch the tip of my nose. I can touch my left earlobe. I can touch my right great toe. It's very simple. So, you visualize. Close your eyes, spine straight. In a silence, I'm talking to guide you, but you practice in silence. You visualize. Visualize there is a flame in front of you. Visualize with your eyes closed. Remember, you're accessing your subtle body. With your eyes closed, just look at that flame. Practice Jyoti Tratak. Jyoti is a flame, Tratak is you're controlling your vision. Closing your eyes, looking at the flame, keep looking as long as you can. In silence, now you bring your breathing. Keep breathing. Breathing out longer than breathing in. And keep the focus in that flame in front of you. Slowly shift your focus to your breath from your visual image. Now bring your silence to the guided breath and to bring the prana in sixth state, dharana. Your prana unites with your mind. Fifth step, 5 senses unites with your mind. Sixth sense, prana unites with your mind. Seventh step, mind unites with your individual soul. And in the 8th step, individual soul unites with your universal soul. Visualize at the tip of your nostril. Remember, you are in silence, your eyes are closed, spine is straight. Visualize air is coming through your nostril. Visualize the air is getting filtered inside your nostril. Your nose is like a personal air conditioner. Outside air is warm, it's going to cool it down. Outside air is cold, it's going to warm it up. Air goes on the side of your nose, called turbinate. Turbinate guides the air. Air goes into the larynx, behind your throat, upper part of your lung, middle part of the lung, lower part of the lung, almost to the level of your belly button. Breath stops there for a while. It's called Kabal Kumbhak. With your practice, you will see the Kabal Kumbhak will get longer and longer. Visualize breath is coming from the lower part of the lung, middle of the lung, upper part of the lung, behind your throat, coming out through your nostril. Breath is the carrier of prana. Prana is the life force. Prana is a subtle energy. Prana keeps us awake, alive, and functional. Prana does all the healing. In yogic tradition, prana unites with your mind during dharana or focus. Visualize breath is picking up prana outside your nostril. Breath is the carrier of prana. Metaphorically, breath is like electric cable, prana is the electricity. In yogic tradition, our whole body does breathing, not only lung. Visualize breath is taking the prana inside our body. Visualize the prana is coming at your heart. Heart is the site of your soul. Heart also is the site of your mind. We use the word all the time, memorized by heart. That means our mind is also in my heart. We have a direct connection between brain and a heart. We know all the physiological connection, we know all the hormonal connection. Now visualize your prana is in a heart. You visualize in a heart center. In a heart centered, you are in silence. Let's stay in silence for a while to practice the journey into silence, which is the outcome of yoga therapy. Eyes are closed, hands are in a Dhyana Mudra or a Jnana Mudra. Spine is straight. Breathing is effortless. Focus is in your heart and you are in silence. I'll give you indication when the silence will be over. Slowly bring both of your hand in front of your heart chakra. Touch your little finger and thumb. Separate your ring finger, middle finger and index finger. This is your Padma Mudra, Lotus Mudra. Lotus Mudra connects your body, mind and spirit. Lotus Mudra takes you to the journey into silence. Slowly bring the Lotus Mudra close to your heart. Keep the lotus in the heart where your prana and mind is uniting in the state of dharan or focus. The focus slowly get defocused. All the chattering of your mind goes away and you slowly enter into a meditation. In the meditation, you have all the thought process. We generate thousands and thousands of thought processes. Majority of our thought processes are in my past. Large number of thought processes in the future. We have little thought process in present. In meditation, you bring all the thought process in the present. You live in present. All the thought process in the present also have a repeat thought process. Same thought process keeps coming, keeps coming, keeps coming. It is called the chattering of your mind, monkey mind. In the meditation, you enter in between the thought process. This is called a gap. Gap slowly and slowly gets bigger and bigger. You still have the same thought process, but there is no repeat thought process. Chitta Vritti Nirodha, controlling the chattering of your mind. Meditation is medication. Between the two words, meditation has T, medication has C. Rest of the letters are same. T is for transformation, C is for choice. Choice of doing daily practice of yoga. Remember, there is nothing called yoga and meditation. Meditation is the seventh limb of yoga. Yoga is meditation. All the health benefit comes from meditation. At the state of meditation, our medicine cabinet of the mind produces every medication which you take from outside source. You really don't need any medication from the outside source. We say we take the medication from the medicine cabinet of our bathroom. In meditation, we get the medicine from the medicine cabinet of our mind. Wonderful healing practice, pranic healing. Slowly bring your hand in front of your heart chakra, anahata chakra. Put your head down. I honor the divinity within you. You are also divine. You are also healed. I am healed. Finally again, finish with again another palming and cupping. Keep rubbing your hands, keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, remove your glasses. Take both the hands, put it over your eyes. Let both the eyes take all the heat from your hands. Massage your forehead, massage your eyes, massage your face, massage behind your ear, in front of your ear, inside the ear canal. Activate the auricular branch of the vagus nerve. Massage the front of the neck. Activate the carotid sinuses. Massage in the back of your neck. It's a wonderful practice, how to control your five senses, how to improve the function of your five senses, how to quiet down your mind, to enter into a state of silence, to achieve the state called meditation is medication. Thank you for joining with us. Come back again on the next Saturday with another topic. And if you have any request, please let me know. I'll be glad to take care of all of your requests. Oh, one more thing, from next week, from tomorrow, we're going to have a time change in the United States. We're going to have a daylight savings time. So we call it a spring forward. From tomorrow, this will be 12 o'clock. So next weekend, when you do the classes for the overseas people, I'll be keeping the same time frame. So you'll be 1 hour behind in your time.